I was a full professor of medicine, one of the most published people in my field. I'm now one of the most published and recognized person in the world on the pandemic. This last half of a decade has been a mind-blowing reality when it comes to healthcare and issues that are close to us.
Once they started to do their own research, because everyone was kind of scrambling and doing it during COVID, they started to realize, oh, a lot doesn't add up that I just assumed added up before when it came to recommendations from the medical establishment.
That was me. Listen, I took all the vaccines. I took 40 flu shots, 40 out of my 69 shots. I cannot be labeled as an anti-vaxxer.
But if you knew what you knew today and you had the choice, would you still take those 69 vaccines?
If I knew what I know now,
here at the Lila Rose Show, no conversation is off limits, and we believe in the power of education, nuance, and data. Last year, we sat down with Dr. Bob Sears to discuss all things immunization schedule, particularly childhood immunization, which I recommend you check out. He gave a very balanced view. But today we're talking with Dr. Peter McCullough, who is perhaps the most influential doctor on the topic of immunizations, both COVID and beyond. And if for some reason this video gets taken down or demonetized, please join us over at patreon.com/Lila Rose Show for extended ad-free, uncensored episodes, merch discounts, and more. I hope you enjoy this episode. Dr. Peter McCullough, welcome to the podcast.
well, thanks for having me.
It's an honor to sit down with you. We were talking earlier and you've been on a lot of shows, and I think your episodes tend to be the ones that blow all the other episodes out of the water because you just say what is on your mind and you're not filtered. So thank you for coming on today. I think this is going to be a great conversation.
Well, thank you. I mean, I think we all would come to recognize in some way this last half of a decade has been a mind-blowing reality when it comes to healthcare and issues that are close to us.
Yes. There is a study that was just done in the last year that apparently the trust in the medical establishment pre-COVID was around 70%. Post-COVID, it has declined 30% or over the 30%. It's declined 30 percentage points. It's now 40% or lower. And I think you are a living example, case study of why that is, because of what you had to face with the medical establishment. Not you personally, meaning you're the one who wasn't trusted, but the medical establishment's treatment of you and millions of other Americans is responsible for that.
Well, the first point I'd make is I am the medical establishment. So yeah, I was a full professor of medicine, one of the most published people in my field in the world in history. I studied heart and kidney disease. I'm now one of the most published and recognized person in the world on the pandemic, both the viral infection, the treatment, clinical strategies, and on the vaccines. So I am the medical establishment. The medical orthodoxy, in a sense, broke from common sense. That's the issue. And they can't explain it. This is very important. So a lot of people recognize me. I'm a frequent contributor on Fox News, Fox Business. I've been on ABC, been on all the major channels. I'm a regular on Newsmax and Real America's Voice and One America News. They see me testify in the Senate and the House of Representatives. Do you know nobody from the medical orthodoxy has done that? This is very interesting. No one from the Mayo Clinic has come out and said, wow, we've taken a great step here and we've come up with a way of treating patients with COVID-19. We're expressing our concerns regarding this approach in the pandemic. Nobody from Harvard, nobody from Yale. This is quite interesting. The medical orthodoxy at this point in time, I would characterize, is shamefully silent on their performance through the pandemic and other related controversies that have emerged.
I think I was susceptible to distrust before COVID because I saw what ACOG did on the issue of abortion. People know my background, very passionately pro-life, and they mainstreamed abortion for all obstetricians, gynecologists, saying that this was somehow healthcare when the vast majority of them at the time in the 70s were not in support of abortion. And they said, this is actually, healthcare, it's medically necessary, all these things. So I've seen institutions become co-opted by ideology. You experienced this personally during COVID and you became really the black sheep of the medical establishment. You are this prestigious member, but then everybody started in the medical establishment to hate you because you were willing to just speak what seemed very common sense at the time for you. I want people to hear that story. I know you've shared that before in other shows, but just as a part of your introduction, you shared a little bit about your background already, but tell us what happened to you during COVID because I think that will help us better understand where we're at today.
Well, let me set the record straight. I've never gotten a hate email or a text or a phone call from anyone in the medical establishment. Nothing. It's been a complete wall of silence. And so when I examined what was going on in the first few months of the pandemic, and some people were getting sick. Now, the case count and the severity of the entire SARS-CoV-2 outbreak was grossly exaggerated. But having said that, I was caring for patients, and some did really get sick. In fact, through the pandemic, I lost 2 patients. So when I proposed that we treat the infection early at home to prevent 2 bad outcomes, hospitalization and death, that's when the medical orthodoxy fell silent. This is very important. It's not like Harvard stepped up and said, Dr. McCullough was right. I was just an endowed, named visiting professor at Harvard in 2019. They all knew me. I'd given grand rounds at Mayo Clinic. It's not like the phone rang from a chairman at Mayo Clinic, one of whom I trained, was my intern when I was a senior resident in Seattle at University of Washington. Not like I got a phone call saying, wow, this is really good, McCullough. I'm glad you're stepping up. No one else is doing it. So we had no one in the first Trump administration and no one in the Biden administration that could articulate the problem. The problem is people were getting sick with SARS-CoV-2 infection. Some individuals who we can largely predict, who are elderly, frail, obese, had medical problems, some were becoming hospitalized, and nearly all the deaths that occurred in the hospital. That was the problem. The solution was to prevent hospitalizations and deaths.
Is that because going on a ventilator was so destructive and quickly would lead to death? What was it about hospitalization, just for people's context here, that was so deadly for people?
Largely, it was the early commitment to mechanical ventilation. And we've published several papers, and I noticed this when I was managing patients as an outpatient, that we could let the oxygen saturation go low and they'd survive. In fact, I had a physician and her husband, and they knew the hospital spelled death, and they got really sick. I said, Dr. McCullough, we're not going to the hospital. We did everything. We did the full published McCullough protocol, which was published in the American Journal of Medicine, still the most widely used protocol to treat COVID-19 in the world. You're talking to the person who devised the broadest, most impactful pandemic countermeasure ever. McCullough protocol has been credited with saving tens of millions of lives and sparing hundreds of millions of hospitalizations. The vaccines didn't do that. We were using the protocol even before the vaccines.
And remind people what that protocol included.
That protocol started with, when you get COVID-19 test positive, get outside, get some fresh air.
You weren't allowed to during COVID.
As simple
the beaches
as that.
were closed here in California.
Nasal sprays and gargles reduce the viral contagion and the viral load. Nutraceuticals and supplements, oral drugs generically available, prescription drugs. And then we moved on to anti-inflammatories, corticosteroids, antithrombotics, monoclonal antibodies. It was the most comprehensive protocol. The McCullough protocol is far more comprehensive than what patients got in the hospital. And so this couple said, Dr. McCullough, we are not going to the hospital. I said, boy, oxygen saturation is getting low. And we were getting accurate measurements. And what we had observed is that provided the work of breathing was acceptable and mental function was okay, that the low oxygen saturation alone was not enough to make the call for hospitalization, let alone go on the ventilator. And so they were, a normal oxygen saturation on the finger measurement is greater than 94%. Hospitals were routinely putting people on the ventilator when the saturation was just below 90%. Well, in this couple and many other patients I managed, they went into the 70s, even into the 60s. And they said, we're a little short of breath when we're trying to, in the kitchen, trying to clean up or what have you. And this went on for weeks.
So that was the standard protocol in hospitals across the country, is to stick them on the ventilator when you dip below 90%.
Boom.
That's wild.
Paralyzed, sedated, no questions asked, no possibility of refusing.
So wild.
And go on the ventilator. Remember, families couldn't be there to advocate for their loved ones. And so virtually every death occurred in the hospital. And one of the things that I noticed, it was a paper published in JAMA in 2020 about what the paramedics were seeing, when they were picking up patients to go into the hospital, and their paramedic reports were like, listen, they're not that sick. It's really, somebody in independent living. They're nervous. They haven't seen their family in a couple of weeks. They're sick. They're not sure what's going to happen. They hit the panic button to go to the hospital, and they never came out. So there were two bad outcomes, hospitalization and death. Neither Trump nor Biden could articulate that. Fauci clearly couldn't articulate that. Trump and Biden completely aligned with Fauci. And so here we go. When we can't articulate the goal of any operation, we certainly can't be successful in achieving it. And our government failed miserably.
You said earlier, well, you didn't get ugly phone calls or texts or emails from past or even current colleagues or those in the medical establishment. They just were like acting like you didn't exist. Right. Like your protocol didn't exist, your recommendations didn't exist, your success rate of dealing with COVID patients didn't exist. They just pretend you didn't exist. If you Google your name, which I'm sure people will do and have done many, many, many times now, you're Joe Rogan's top podcast episode. Wikipedia, calls you, peddler of misinformation. You lost your board certifications. So it seems that perhaps if the medical establishment isn't directly attacking you because maybe they have no legs to stand on, the media certainly is.
Well, it's interesting. The medical media and particular sources in the medical media. So there's MedPage Today. There's factcheck.org.
Live Action's been hit by them. And dishonestly, of course, on Fact Check's part.
But the funding sources behind these, and we've looked at it carefully, the funding sources behind everybody that's hit me is what we call the biopharmaceutical complex. And in my first book, Courage to Face COVID-19, Preventing Hospitalizations and Deaths While Battling the Biopharmaceutical Complex, we define the complex. What is this? What is this cartel that is advancing the pandemic narrative? And what we found is that clearly it's dominated by non-governmental organizations, the World Economic Forum, the World Health Organization, the United Nations, CEPI, the Coalition for Epidemic Preparedness Innovation, founded by Gates Foundation and World Economic Forum, the Gates Foundation, Rockefeller Trust, Wellcome Trust, Gavi, UNAID, a government organization, and the list goes on and on. They're working in careful collaboration on pandemics and pandemic responses. And to articulate, you say, well, why are they doing this? What's best memorialized is the business plan for CEPI, Coalition for Epidemic Preparedness and Innovation, funded to the tune of billions of dollars, founded by Gates Foundation and the World Economic Forum, and other companies contributed. And what CEPI said in 2017 is there's going to be a series of pandemics, a series of them, one after another. And for each pandemic, there will be only one solution: mass vaccination. Why did they write that in 2017? Why did that seem to play out in 2021 when the vaccines rolled out? CEPI has written a white paper on Disease X. There's going to be another one. It's called Disease X.
Are you implying there that they somehow had a hand in creating COVID? I know there's obviously the theories about COVID and a lab and the government's involvement, and it kind of got, the lab leak got out of the lab and it was engineered by scientists trying to prep for potential future pandemics, and then we accidentally created our own pandemic. Are you saying, is that your perspective, that this could have been engineered by these global
I brought up the biopharmaceutical complex when we mentioned this medical media and factcheck.org. Factcheck.org is directly funded by the Annenberg Foundation, which is at University of Pennsylvania, which is directly funded by the Gates Foundation. There's a direct relationship. Factcheck.org probably has dozens of posts. What Dr. McCullough says, that's not true. Dr. McCullough has been discredited. So there's a direct relationship between this biopharmaceutical complex and the medical media who's pursued me and other doctors in my circle.
I think what it sounds like you're saying, and I've heard this before, and I think it makes sense, is that there is this understanding that there have been pandemics historically, obviously, There may be pandemics in the future. Their whole job is pandemics, in part, some of these institutions. That's certainly what funding goes towards, studying them and preparing for them. And so, and in their view, vaccines are God's gift to humanity. And so we should obviously have a vaccine when there's a pandemic. So my sense of it is it's not some grand conspiracy. Let's create the pandemic and then let's go, push vaccines on the people to solve the pandemic, as much as it is they're just very much wired to think pandemic, vaccine, solution, give me money. I'm going to keep doing this rinse and repeat when it happens.
What you say may have been true at the beginning. But in my second book, Vaccines, Mythology, Ideology, and Reality, we bring up these epochs of time over the last 300 years. We're in the fourth epoch now. Started in 2004 with the U.S. BioShield Act, and then 2005, the PrEP Act. These memorialize this idea that we're going to have pandemics. They will come as a threat from man-made biological pathogens, viruses, bacteria, and fungi. This is written into U.S. law. I mean, it is there for everyone to read. And that we will get ready with countermeasures. And the principal countermeasure is a vaccine, but it could be a therapeutic, a test, a personal protective equipment. And these countermeasures will take maximum priority budgetarily. They'll be free of any liability. And we'll have government agencies working on both. And in 2024, the Biden administration memorialized this with some written legislation. And it's concerning pathogens of pandemic potential that have a dual purpose. It's very important. It's legislation. It uses those words and says, listen, there are labs working on the next pandemic pathogens. This is going on. The U.S. is funding this. Not-for-profit agencies are funding this. They're at university laboratories, government laboratories. This is going on. So here's some legislation. We're going to catalog everything we're working on and what are the threats and then what are the answers. But the goal of creating a pandemic pathogen is to come up with an answer, let's say a vaccine. That's what was going on in Wuhan, the Wuhan lab. And whoever creates the bona fide threat and the bona fide solution holds power.
The best thing that we can do this new year is to pray more and enter more deeply into our relationship with God. And that's why I love Hallow. It's the #1 prayer app in the world, and it features guided meditations, prayers, Bible in a Year podcast, daily mass readings, and so much more. My kids love their kids' content, including their Bible stories and sleep stories designed just for kids. You can download the Hallow app today and get 3 months free at hallow.com/Lila. That's hallow.com/Lila. On this show, we support moms and babies in everything that we do, including how we shop. EveryLife.com has premium diapers, baby products, and women's products. We use their diapers in our household, and they are made from the highest quality materials, are supremely soft and breathable, and are leak-proof for up to 12 hours. When you sign up for EveryLife.com's Changing Lives Club, you get 15% off every order, a free tote, an exclusive online community, and after your third order, you can select a church or a pregnancy resource center, and EveryLife will donate a month's supply of diapers on your behalf. You get the best baby and women's products delivered right to your door, and you get to help moms and babies in need. If you use the code Lila at checkout, you'll get an additional 10% off your first order. Save lives with pro-life diapers, wipes, hygiene, and women's products over at EveryLife.com. Use code Lila at checkout. Are you saying there should be no anticipatory research done on potential future pathogens or viruses that cause pandemics and potential future work done to help prepare vaccines? What should they do instead?
Well, I would say it's very similar to nuclear bomb research. I mean, should there be nuclear bomb research and then nuclear defense systems? Well, yeah, there's research going on there. I mean, countries are in the business of war, but these viruses, fungi, and bacteria are not just a scientific curiosity.
They can be the business of war too.
They are the business of war. They are the intention of war. And so this idea, well, let's just have the Chinese come in and fund a biolab here in California.
That seems problematic on its face.
Right. I was like, okay, we're doing this.
And I think most people would agree. That
and how
seems
about just this voluntary reporting that the Biden administration has? Well, you can voluntarily report this. I'm on a standing committee in the Arizona Senate. And the senators always ask me, Dr. McCullough, what can we do to be prepared? I said, first off, call in all your health systems and let's review what they did in the first pandemic. How did they do? Which hospitals in your state had the highest mortality? Which one had the lowest mortality? Do you know what a single state has done a pandemic review of hospital care, including California? Do you know that no single state has actually done an inventory of these biolabs in their states?
So, I mean, all that seems silly. It seems like those inventories should be taken, analysis post, the postmortem of the system that was supposed to manage postmortems should be evaluated. But in terms of, I'm very interested in, I know a lot of Americans are very interested in, and the people who listen to this show, what is the solution? And you've seen it firsthand, and you've been critical. To your point earlier, your focus has always been solutions. You were trying to seek solutions for your patients and recommend solutions for other doctors in the medical establishment to practice. You are, though, very critical of how it's been operating, and this whole thing that you're describing, your first book that you just mentioned, how that this complex, as you call it, that exists. What is the solution? What should the posture of the government and the medical institutions be to the potential for future pandemics? What would you recommend as a solution?
All I can do is say, what would I do if I was in a leadership role? What would I do if I was president of the United States or secretary of HHS or commissioner of the FDA, and the list goes on? That's the fairest question to ask, right? So, boy, talk about our last two presidents, right? Trump and Biden. I mean, there's just a work list of things to do. Admit the pandemic mistakes that occurred. Fauci has to be brought up for investigation and potentially court proceedings. We have to remove the COVID vaccines off the market since they failed, and there's giant concerns over injuries, disabilities, and deaths. We have to have Washington review of what happened in the hospitals. We have to have review of why were Americans denied early treatments that doctors were finding successful. We do need an inventory of these biolabs. Trump has pulled federal funding for the biolabs, but that's probably a minority of funding. We have a $1 billion budgeted pandemic response unit in the National Institutes of Health. It's called BARDA. And they actually report directly to Robert F. Kennedy.
What is it doing?
Well, we'd ask that question. Who's running BARDA? What are they doing with $1 billion? How many projects do they
Is that an
have?
annual fund that they
That's
get?
an annual budget.
$1 billion every year.
Look at what the CDC has. It has a $9 billion budget, 12,000 employees.
Yeah, what is happening? I mean, is that research
people with
money typically?
my types of training. What are they doing? What are they doing every day? I mean, these are fundamental questions. So if I was in Trump's position, oh my Lord, America would be a different place. A different place. Have
you been in touch with the administration about these recommendations that you have? They sound very common sense.
They watch me every night on TV. That's all I can say. My phone is available to all of them.
But no direct contact.
Well, here's the point. This idea that the administration doesn't know or that you and I should go knock on their door. No. There are employees. They have tons of people working for them. Their job is to contact us for our opinions. This is very important.
I agree in theory with you. I agree in principle with you. That said, I know on the work that I do in live action, as an example, we're constantly writing memos, white papers, communicating behind the scenes, because as true as that is the case, unfortunately, the way of the world is, people just are shiny object syndrome. They've got a million things in their desk.
Oh, come on.
The easiest thing that they have given to them as a public policy proposal that they think they can get done, if it's done, like literally the homework's done for them, they're more likely to implement.
It's hard to imagine our government employees, and they all are employees, are that feeble. They probably are. Yeah. But the point is, listen, if our commander-in-chief communicates with us by a Truth Social post, I'm sorry. It's perfectly fine for me to post something on X or Truth Social or Getter and tag them, and they better pay attention.
I mean, again, I agree in
listen,
principle.
have you ever done a FOIA on yourself?
On myself? I don't know if we've done a FOIA on myself.
You should.
Interesting.
I did a FOIA on myself.
Lots of comms.
There's tons of government people watching everything that I'm saying. So I am not here to say that, wow, the government administration doesn't listen. I've testified in the U.S. Senate 5 times. 5 times. Listen, U.S. Senate testimony. Anybody from the executive branch can and should show up to that testimony.
And you know, to be fair to you in this conversation, of course, there is a posture from certainly the Biden administration, but I can say for the Trump administration that if you have dissent, if you disagree with anything that the administration is doing, they're not going to stand for it. So there are lines of communication that are easily broken with the White House. And you can understand it from a political perspective because they're trying to win elections. So if you're like not 100% lockstep with their agenda, then you're actually an obstacle to them, right? So do you think that's a reason why it's been more fraught with the administration with you, because you speak very freely, you're going to call a spade, left, right, either way?
I can't explain their ineptitude. I really can't. It's this idea of,
Okay.
Why are they fumbling around as badly as they are? I can't explain it. I mean, you can't. We're in some type of mind-blowing reality. I go to Capitol Hill. I'm typically the lead witness. These things blow up on social media.
They do. They
blow up on social media. I go on very, very high level programming all over the world, for that matter. I've testified.
What do you think's holding them back? What is holding back? Would you say?
I can't explain what's in the minds,
the deep state,
the clouded minds of people. I can't explain it. Remember, when you talk to most people about this, and particularly if you talk to them about the COVID-19 vaccines, do you know what the very first response that's usually emitted back? I don't want to talk about it. The Heisman Trophy.
This is from everyday Americans, you're saying, or the administration and people in government?
Virtually everybody who took the vaccine.
I see. I mean, I think it is like, this is going to be a very, a hot take right here. Like circumcision. If someone's been circumcised, they don't want to in any way have it criticized. And they're going to say, of course, everyone should be circumcised. With vaccines, I think there's some similarity. If you've had the vaccine, you'd think, of course, everyone should have a vaccine. So it sort of, in a way, marks you that, yes, has to be normal for everyone. Psychologically, it's hard to say, I shouldn't have taken that vaccine, or I shouldn't have been circumcised, or whatever it is.
I'm glad you brought it up. It gets into what we call ideology. And that's in the title of my second book, which is a New York Times bestseller, Vaccines, Mythology, and Ideology and Reality. Well, what is vaccine ideology? It goes back centuries, and it's been building. But it goes like this, that mankind is vulnerable and susceptible to infectious diseases. And now in this era of biological threats or bioweapons, we could be wiped out by somebody else because of these. But we're vulnerable. And through the brilliance of mankind and vaccinology and science, man improves upon God's creation. Man outdoes God. This is the ultimate hubris. The ultimate hubris. Mankind takes a healthy human and makes them better through vaccinology. But the vaccines aren't perfect. So for this to work, we all have to take them without exception. There will be no vaccine hesitancy. Vaccine hesitancy is a bad thing. Vaccine acceptance is a good thing. And if some people are injured, disabled, or even die due to this wonderful creation, we should accept that.
It's collateral damage.
Collateral damage. We should take it for the team. That's vaccine ideology. That goes back to 1721 and Cotton Mather.
Is that the smallpox?
That's smallpox.
Yes.
That was with variolation. He is a Puritan minister, 1721, Boston, Massachusetts. He's working with Dr. Boylston. They haven't even gotten to vaccines yet. There's no needles back then. They didn't even know what caused smallpox. They were just taking a scalpel and trying to transfer from one child to another through the pustules. Cotton Mather declares that this process of variolation is a gift from God.
Was it though? Did it succeed at all? The smallpox early vaccine form used to try to combat, rampant disease and death. Was it successful at all?
No large studies, very unclear.
Because I think the common understanding of that historically was like, yeah, it was very early form vaccine. Like you said, they kind of like scraped your body and got you under in their blood somehow. But it was actually at large, even though it like violated people's bodily autonomy in terms of like they were forced to do it, the soldiers, everyone was forced to do it. It was overall a good thing. I think that is the mindset today.
Well, that's how historians write it, but do we know? So for instance, King George III has more than a dozen children. 2 of his children died directly after variolation.
But did any die from smallpox?
We don't know. Here's the thing. People didn't even know what caused smallpox. No one could even know if they were exposed or unexposed. All we know is smallpox essentially went away with less than 10% of the world vaccinated. So,
what do you credit that to? Is that because of better hygiene?
Yeah, better sanitation,
better water,
better sanitation, nutrition, and hygiene. As soon as we quit having kids with smallpox pustules, sleeping with other kids and spreading it, once we actually learned how it spread,
how disease spreads, yes.
Sure. If you have somebody with smallpox today, they'd go into isolation for crying out loud.
I think in the kind of common mindset of the modern person today when it comes to vaccines, we think about something like the bubonic plague, which sounds so terrifying, right? And how it killed 1/3 of the population. Mm-hmm. And if we had lived back then, how horrible that we would have all been. 1/3 of our, families would have just been wiped out. There's nothing to stop it. And thank God for modern medicine and vaccines because things like that don't happen anymore. Well, that is, I think, the large
So good you mindset. Mentioned it. No vaccine for bubonic plague.
It doesn't exist today is what you're saying.
Right. So bubonic plague went away, no vaccine. Listen, there were illnesses in my training that were more common, like rheumatic fever. That's gone away. We used to have tuberculosis sanatoriums all over the United States. Tuberculosis came under control.
Well, but people credit tuberculosis being under control with vaccines.
No, we don't vaccinate for tuberculosis here.
But the reason that it's not a widespread outbreak of tuberculosis is because I think people believe previous vaccinations that have been done in past generations.
No, we never.
Tell me more about that.
We never vaccinated for tuberculosis. There's only one worldwide tuberculosis vaccine. It's not even used in the United States. It's called the BCG vaccine. It's used in places like Haiti and other developing countries. Tuberculosis came under control because of testing, isolation, and treatment. It's very important. Rheumatic fever came under control again because of testing and antibiotics. There's no vaccine for rheumatic fever. There's no vaccine for scarlet fever. The point is, all infectious disease threats came under control without vaccines. Even HIV came under control with multi-drug treatment. There's no HIV vaccine.
And with tuberculosis, you mentioned the BCG vaccine. That is used in countries where TB has been a problem. It's not used in the U.S.
It's never been used in the U.S.
So kids are not being vaccinated for tuberculosis in the U.S. and they're not dropping dead from it either, to your point.
Right, and when they're not being vaccinated for streptococcus, they're not being vaccinated. So the point is, all of these infectious disease threats, these vaccine-preventable illnesses, were all going away, if not completely gone, before the vaccines ever come on the scene.
Tell us about polio. Figuring out the right daily nutrition can feel overwhelming, but one thing that I consistently rely on are the supplements from WeHeartNutrition.com. I'm a huge fan of We Heart Nutrition. It is a pro-life, family-owned business that donates 10% of every purchase to pro-life causes. We Heart Nutrition makes premium research-backed supplements here in the USA for men and women at every stage of life in the supplement's most bioavailable form for maximum absorption and digestion, from preconception to pregnancy, postpartum, menopause, and more. I personally take the postnatal supplements and have been taking them since I gave birth to our last baby, and it has helped me feel healthier than ever after my last pregnancy. You can take We Heart Nutrition's 2-minute quiz to figure out which supplements can best benefit your state of life at WeHeartNutrition.com and use the code LILA for 20% off your order. That's WeHeartNutrition.com and use the code LILA for a full 20% off your order. At my house, we've been using Cozy Earth bed sheets, bathrobes, pajamas, and blankets, and they are a family favorite. The sheets are made from 100% viscose from bamboo, and they get softer with each wash. The pajamas are also a soft stretch knit that helps keep your temperature right through the night. Right now, Cozy Earth is offering their Baja bedding set, which is their first complete matching bedding set with elegant and serene colors and design. Their luxe bath towels give a little bit of luxury in the midst of everyday chaos of life, and they are impossibly soft and plush. Every purchase from CozyEarth.com also comes with a 100-night sleep trial. Love it or return it for free, as well as a 10-year warranty. So you'll know that it will last at least a decade. Right now, you can go to CozyEarth.com and use my code Lila for 20% off. That's Lila for 20% off. Make every day feel like a new year with Cozy Earth. Tell us about polio. You talk about this in your book, and this is a very common narrative because there's these, the iron lung, the images of the children, those black and white images in the 20s or whatever it is, and they're dying and they need to go on the iron lung because of polio. And then the vaccine shows up and all of a sudden everybody is freed of the grips of polio that has taken the country by storm. Again, this is like the collective imagination of how our history, our understanding of history. And people point to the polio vaccine as it's God's gift to mankind. And it's the reason why, of course, we should trust the medical establishment for all these other vaccines that are being presented, because it's going to prevent outbreaks like the polio vaccine, outbreak that was so destructive.
I have patients who've had polio in my practice. So I know exactly what polio is like. They had polio as a child. Polio is very interesting. You can't find evidence of polio thousands of years ago. So it's not like the Romans were afflicted with polio.
Well, we don't know.
But you can't find evidence of it, though. It just seems to come on the scene in the basically the early 20th century. And there are outbreaks. They largely occur in the summertime. Very interesting, summertime. And it is a virus that's fecal-oral transmitted. So it's actually from feces to the mouth. That's actually how it's transmitted. So it's a paralytic disorder of a particular part of the spinal column. It's known to be a virus that's transmitted in a fecal-oral transmission. It's in the water, essentially. It's in the water, and it's from lack of hand washing,
bad hygiene,
changing diapers, things like this. That's polio. But you can't find evidence of it, bazillions of people paralyzed thousands of years ago. You just can't find it. So it seems to come on the scenes. It's part of urbanization. Believe it or not, it tended to afflict wealthier families, which is quite interesting, and tended to not afflict underdeveloped countries.
Do you think that, though, that's just a matter of detection, that it was happening and just wasn't understood or detected the way it was by wealthier families?
No, it actually may be a product of immunity, that, it's an endemic virus. There's all kinds of endemic GI viruses that is probably endemic all over, but we got to a certain level of cleanliness where we didn't have that population natural immunity. Then there was susceptibility when your child went into a daycare center in the 1940s or 1950s, or went to a beach on the Atlantic coast. I mean, there was all kinds of polio outbreaks. Now, having said that, there was great confusion over what polio was. So, any form of childhood paralysis was called polio, any form. And there was a famous University of Michigan study, 1,200 kids with polio. And they finally had the test to figure out who had polio and who didn't, because other things can be shoulder and hip dystocias. There can be transverse myelitis. There can be Guillain-Barré syndrome, all kinds of other things that are polio mimics. And so it turns out the University of Michigan study showed a quarter of polio was real polio.
Wow.
Okay, so we had that.
So even only a quarter could even interact with the vaccine.
Right. Well, only a quarter could, quote, be impacted by the vaccine. Yeah. But then the height of the polio epidemic, and it's in our trials, the Salk field trials are done during the height of this. It's in our book, in the chapter on polio. And there, 1.8 million children are enrolled in a clinical trial. Some get the actual shot, some don't. There's controls. It's not a perfect randomized trial, but it's pretty darn good. And out of 1.8 million children, in the height of this disaster.
What year are we right now?
Around 1953, 1954. Do you know how many cases of polio there were?
How many?
Less than a couple hundred.
Out of 1.4 million children enrolled in
Out
the
of
study.
1.8 million, a couple hundred.
And was this the advent of the polio vaccine?
Yes, this was the
advent. So it's not like the polio vaccine had already been taken and everyone's free of polio.
No, this was the IPV. This was the vaccine.
That's wild.
And so
how many again?
A couple hundred. And
that's insane.
And what was the vaccine efficacy? How good was it in preventing polio?
For those 100 kids are
about 60 to 70%. That's in the published Salk field trials. So I'm here to tell you the polio vaccine did not make polio go away. It couldn't have. It's impossible. Even if everybody took the vaccine, it was only partially preventive. What made polio go away is we developed, we finally really got to a sterilized water supply. Things got clean, and and we moved on from there. But we have polio detection systems. Our CDC does it. We haven't had polio in the Western Hemisphere in 20 years. I guarantee you've never been exposed to the polio virus.
There's a famous chart, I don't know if it's in this book, you can tell me, or I can try to pull it up online, of the decline, the precipitous decline, it seems like, in polio being detected in the population. And it kind of lines up with vaccination. And so people point to that and say, this proves that vaccination was responsible, but there was another event that took place.
Well,
that was more significant than vaccination.
Well, it came with this idea of testing. Remember, everything was polio until we had the diagnostic tests. So the diagnostic tests immediately dropped the case count to 25% of what it used to be.
So are they crediting the decline in polio with the vaccine when it was really testing that declined polio because it's not polio anymore?
Yes. And that's
wild.
By the way, the same thing happened with measles, mumps, rubella, all of these. So there's an excellent resource, and we rely on it in our book. It's called Dissolving Illusions by Roman Bastianic and Suzanne Humphreys. And the famous charts in there from the U.S. Departments of Vital Statistics showing all these infectious diseases going down before the advent of the vaccines. So vaccines have never quelled an outbreak or a pandemic. See, it's a fool's errand to think, wow, a pandemic, answer, vaccines. No. In fact, what we saw with COVID was pandemic, vaccine. If we vaccinate into a widely prevalent pandemic, the virus will outsmart mankind every time. The virus becomes resistant to the vaccine every time.
So now COVID has mostly subsided.
Well, there are.
But you don't credit the vaccine with that.
No, there are.
I'm playing devil's advocate here.
There are reports that we're on our 14th wave of COVID.
Some really nasty flus going around.
So one thing's for sure is that we don't have people hospitalized with COVID-19 now, right?
Do you credit the vaccine with that?
No. There are three things that made the case count and hospitalization and death go down. It's very important. One is natural immunity. And we knew that because in 2020, that was happening. People who got over the infection were not falling ill and dying on the second and third infection. For sure, we knew that. There was multiple papers showing that. That's before the vaccines. So vaccines couldn't have played a role in the good health of people who got through COVID after that first episode. So natural immunity is number one. And 97% of us have had COVID now. So nobody avoided it. Number two is that the virus mutated and became milder. It's clearly milder now than it was the original strains. All the experts agree. And then number three, therapy, treatment. Treatment specifically started early reduces the risk of hospitalization and death. That's the whole goal of doing it. So those things directly reduce the risk of hospitalization and death. I don't think vaccines played a role. Why? Because virtually everyone took a vaccine in most countries. So it couldn't have done much, right? Because everyone took it and we still saw this play out. There were more deaths due to COVID after the rollout of the vaccines than before. So it's not like we can say, well, a vaccine that would have worked would have immediately, COVID just would have dried up early in 2021. We wouldn't have seen any deaths. By mid-2021 or the fall, it would have been over with.
I think people would say, well, those that defend vaccines, they say, well, it's not about perfect immunity. It's about lessening the degree, the intensity of the disease. And that's what, the public health officials are saying about the COVID vaccine. You're going to get COVID even after the vaccine, but it's going to be much of a lighter case. So you're not going to have many complications.
But that's a late secondary claim. Remember, the initial claim is it's going to stop. You
You're
take
right.
a vaccine,
No, you're
it's
right.
going to stop.
They changed the claim a few times. It's true.
Right. So that became a backup claim. Now, we don't present other vaccines that way. We don't say, here's the polio vaccine. You're still going to get polio. It'll just keep you from being severely paralyzed. You'll be paralyzed a little bit. We don't present other vaccines that way. Well, so this idea of...
I think they do with MMR? Don't they say that about measles or mumps, that you can still get it, but it's going to be less severe? It might not be life-threatening anymore.
Again, in order to make a claim like this, we need a large, prospective, double-blind, randomized, placebo-controlled trial. And with COVID, there were billions of dollars available to do such trials. The trials that were done showed no reduction in COVID hospitalization and death. None. So if you take a consent form for the COVID vaccine and say, what's my benefit of taking the vaccine? It doesn't say it's going to save your life. It's a false claim. It's a false claim for anyone to say the COVID vaccines will reduce your risk of hospitalization and death.
As I remember, the claim became you're actually taking it for your neighbor, because now you may still, I think the claim became you're going to get a less intense case of it, and now you can't expose other people the same way.
Well, listen, our CDC director came out in August of 2021, Rochelle Lewinsky, press release. Hey, everybody, we got the answer. It doesn't stop spread of the infection. You can give the COVID virus as easily to someone if you took the vaccine or not.
So wild.
So it started out by saying it's going to stop COVID. It didn't. The CDC kept track of serious cases up through May 1st of 2021. There were so many vaccinated people getting hospitalized and dying that they gave up. They stopped tracking. They announced, we are no longer tracking this. It's obvious it was failing. Fauci in April of 2021 came out and said, you know what? It's not working. We're going to need boosters. Rochelle Lewinsky comes out in August of 2021 and says it doesn't stop spread. So when I was in the U.S. Senate 2025 in May, Richard Blumenthal, a Democratic senator from Connecticut, said, well, the vaccine saved millions of lives. And I said, don't you dare make a false drug claim here in the U.S. Senate as a government servant to us. That's a false claim. If it's not in the package insert and if it's not in the consent form, we can't make claims, drug claims or vaccine claims.
Do you think the COVID vaccine saved any lives?
I don't know. I don't think so. It's early on, maybe before the virus mutated in January or February of 2021, maybe somebody was spared for a month or two. But all experts agree the vaccine ran out of any protection after a couple months. So then the person's vulnerable again.
Do you think the vaccine took any lives?
Yes.
How many? Any sense? What's the data that we have? What's our best data on that?
Well, doctors like myself see patients who've taken the vaccine and they die of a vaccine syndrome right in front of us. Myocarditis, heart failure, a blood clot. It's crystal clear.
And that's within 24 hours of the vaccine?
More than 1,000 Americans have just died right within 24 hours. It was so deadly, people were dying in the vaccine center, and they had to announce, we need to have resuscitation equipment in the vaccine centers. Remember that? Yeah.
I think the things that scared a lot of people was myocarditis and other...
well, sure. But you're asking how many...
After, not within 24 hours, within months later.
Well, the first terrifying thing was dying in the vaccine center. So our CDC is keeping track of all the reports that doctors make like me. And we report it to the Vaccine Adverse Event Reporting System. The first 3 or 4 pages is all about the doctor. Who are you, doctor? Why are you reporting this? Where's your office address? Where's your email? Where's your phone number? Believe me, these reports are serious. And any spurious reporting is punishable by federal fines or imprisonment.
Are you implying there's a lot of doctors that may not have reported vaccine deaths or injuries because it's too scary?
I'm implying 2 things. One, a lot of reports aren't made because people are scared to death of doing the report. And number 2, the ones that are made are the real deal. They are legitimate and people are serious about this. They've already determined the vaccine is a cause of death. As a practicing doctor who's board certified, which I am, and I'm seeing patients every day, I'm not going to report a death that's not due to the vaccine. Why would I risk my license doing that? Why would I risk my a professional career. Why would I risk federal fines and imprisonment? I'm only going to report something for sure that I have clinically determined the vaccine is the cause of death. An administrator at the CDC doesn't determine the cause of death. The doctor in the field, and nurses and directors of nurses at nursing homes and medical doctors, they do these reports.
How can you determine cause of death from a vaccine? We're talking specifically about the COVID vaccine right now.
The clinical scenario, did they get a vaccine and what was the context? What was the time frame between the vaccine administration and the fatal event? And what was the fatal event? Is the fatal event something known that the vaccine causes, like myocarditis? Well, for sure, it's in the package insert. Do the vaccines cause blood clots? For sure. In the peer-reviewed literature, do they cause fatal Guillain-Barré syndrome? For sure. Fatal autoimmune problems? Definitely. So when we have the clinical vignette, we have the scientific support that the vaccine causes the problem, and the doctor makes the determination, we report it to VAERS. Well, how many of these deaths are in VAERS of Americans? 19,500.
From the COVID vaccine alone.
From the COVID vaccine alone.
But I think I've heard the criticism of VAERS is that these are, self-reported, I guess you can say.
Hang on. Self-reported. The CDC knows every single report.
So they vet the report to let them remain in VAERS?
Oh, for sure.
So
they get a temporary VAERS number, then they get a permanent VAERS number.
So the CDC does reject some VAERS reports.
They have the opportunity to do that, but importantly, the CDC has the opportunity to report who's reporting. Okay. And so if the CDC thought that just lay people were making up these reports and submitting them, why haven't they generated a report? There's one paper published on this by Meisner and colleagues. This is before the COVID vaccines. And the answer is 86% of the time it's a doctor. And then the other 14% of the time, a lot of times it's the drug company that's thought, geez, it looks like our vaccine caused it. And before the COVID shots, there's about 150 vaccine deaths per year reported to this system, 150. Can you imagine with the COVID shots, within the first few months of the campaign, we had 1,600 Americans that have died.
So walk me through, tell me this like I know nothing about this. So VAERS, and for folks listening, so VAERS is a system to somehow take account of vaccine injuries and deaths. And what you're saying is that when a doctor makes a VAERS report, they need to fully disclose themselves, who they're from, et cetera. And the CDC, the government's tracking which doctors are making which reports. But more than doctors, everyday people can also make reports. Is that true? So if I'm a mother, I think my child is injured by a vaccine, I can make a VAERS report.
Correct. Now you're going to have to list your doctor, the vaccine lot number, et cetera. But my point is...
But you're saying 86% of these reports are made by doctors. They're not made by mothers, fathers, individuals.
From a prior paper by Meisner before the COVID vaccines. But the point I want to get to is that if anybody is claiming that what's in VAERS is not due to the vaccine or not reported by doctors, go ask the CDC. They have all the data. Why has the CDC not told America who's reporting all of these deaths? 19,500 deaths. In FDA testimony, the underreporting factor is estimated to be 30. So how many deaths is that really? I have patients in my practice who have died. We can't find the vaccine records. The family can't find them. I can't report them to VAERS. So the point is, underreported 30-fold. The answer is 550,000 to 600,000 Americans have died after the COVID-19 vaccine as an estimate. There are 38 other reporting systems in the world, just like VAERS, like the yellow card system and the DAN system, and they show the same signals.
So other more non-U.S. but other reporting systems show similar numbers to that estimate that you just said.
Correct.
For a population. So when you were describing the doctors that make the VAERS reports and they are making a judgment about whether or not the vaccine was what caused the injury or the death, that technically my understanding of VAERS though is it's not so much conclusive that this injury or death was from the vaccine. Again, this is devil's advocate about how people see VAERS and understand it typically today. It could just be something correlated with the vaccine. So we don't know for sure that the vaccine was the culprit for the injury or the death. it could just be a correlation. But you're saying when the doctor makes the report, he's saying, no, in my judgment, this is a consequence of the vaccine.
No, it's not a correlation. It's a safety report. And the intent of reporting is in the context of getting the vaccine. 100% of people in VAERS got the vaccine. It's not a correlation. It's not like some people got it and some people didn't.
Well, no, what I'm saying is in terms of you are saying in your best judgment and as a physician, you make the judgment of, was this a consequence of the vaccine as opposed to just correlated, this death or injury?
Correct, because I know the patient. I've seen all the hospital laboratories. I've seen the CPR. Nobody at the CDC can see all that. Nobody else. So when a doctor makes that submission, it's considered caused by the vaccine by proxy of reporting. Because if it wasn't caused by the vaccine, it wouldn't have been reported.
But then for the non-doctors who are making the report, the individuals, they are just basing it on their best guess via correlation.
Deb Conrad is a PA, physician assistant in Rochester, New York. She was faithfully making VAERS reports of deaths and non-fatal injuries at Rochester General Hospital. But here's the point. Listen, she's an educated professional. She can make that judgment. So can nursing home administrators and chief medical officers. They can make that report. Deb Conrad was fired because she was making VAERS reports.
How can we improve the VAERS reporting system to prevent the distrust? The distrust by some Americans who think that it's over-reported and people are misinterpreting an injury or a death and blaming the vaccine for it unfairly, and by people who think VAERS is under-reporting and there's no proper system, because it's all voluntary. VAERS is totally voluntary. And so there's then Americans in the other camp who say, well, VAERS doesn't work because it's all voluntary, and doctors are terrified to make a report because they're going to get flagged and get in trouble.
Mm-hmm. Well, a solution would be for the CDC to release the vaccine administration records, and then to, they can be de-identified and anonymous, and they should, it's a public data set, and they should allow a merge with the National Death Index. So if we knew who got the vaccine, which we do, and we know who died, which we do, because it's all, when people die, they get off the rolls of Medicare, they get families get life insurance. Death is known in our country. So we know everybody who got the vaccine. We know everybody who died. We can start with people who died on the day they got the shot all over the country, who died the next day and the next day.
What people would say in response to that is, well, every day there are thousands of people dying every day in America. So if one day in America, 20% of the population gets vaccinated, right? Of that 20%, X number we're going to die regardless of the vaccine.
It's a foolish argument. The vast majority of people die in the United States die of chronic disease, and it's
not random, is what you're saying.
It's fully expected. They die after a long course of heart disease, and they die in heart failure and hospice, or a long course of cancer, and they die in hospice, or they die of some non-cardiovascular, non-cancer disease. And 40% of deaths are cancer, 40% heart disease, and 20% other causes.
Or they die in a car accident, and it's very clear what killed them. It's a car accident.
Well, they can die in the car on the way to the vaccine center or on the way after the vaccine center. But what I'm saying is reporting deaths by vaccination status, there's only been one country in the world that's done that. It's the Czech Republic, and believe me, it's not good.
What are the numbers in the Czech Republic?
The vaccinated die at much higher rates. And
this is already taking into account, removing people that are dying from car accident injuries, removing people that were already on hospice and going to die likely anyways.
A full disclosure of the data.
It's crazy. That would be very revealing.
Yeah, no government in the world has fully released the data. You're asking, how can VAERS be better? Why doesn't the CDC do a report on who is reporting to VAERS? When are people dying? All we know is this 19,500 for sure, probably underreported by 30. Among the 19,000, what we see is over 1,000 die on the same day they got the shot. Another 1,200 die the next day. So if I was RFK or Jim O'Neill, who's the acting director of the CDC, why do we have an acting director for a year who's not a medical person? I don't know, but it's not good. If I was either one of those positions, I'd immediately call for an examination of who died on the same day they took the shot, who died the next day, and what were the clinical descriptors of what was going on. Did they die of blood clots? Did they have cardiac arrests, fatal allergic reactions? What was going on? Listen, if we had 1,000 deaths of people who took acetaminophen or ibuprofen or Benadryl over the counter, there'd be an immediate investigation.
Well, it's the vaccine, it's the immunity that the vaccine companies have, right? That's the whole issue here. They're not, even if they are causing deaths, it doesn't matter. There's no recourse for people.
That could be your opinion. It's not mine. I got to tell you, it's not mine.
No, I'm just saying that as a fact, though, right? I mean, there's no recourse for vaccine.
It's not
for people who are vaccine injured in terms of suing vaccine companies.
It's not about legalities. It's about what's right and wrong. We should never have a healthy person take any drug or vaccine and lose their life. A healthy person dead from something that was supposed to
help them
theoretically prevent disease. So what was the first case that ironclad someone died of this vaccine? It was in Washington University in St. Louis. It was a 42-year-old man who took Moderna. Healthy. He goes into Washington University in St. Louis. The vaccine essentially rots out his heart right in front of the doctors, and he dies.
Within minutes of the vaccine?
Within days. His body's examined. It's published in the New England Journal of Medicine in August of 2021. Conclusion, the vaccine killed him.
How? Can you just explain for
Fatal
people?
myocarditis.
But what was the mechanism in the Moderna vaccine that caused
the
fatal
vaccine
myocarditis?
Physically goes to the heart. It starts producing the lethal spike protein from the virus, and it literally rots out his heart. Now, if that's not enough, a few months later, Gill and colleagues from Connecticut report two teenage boys, 16 and 17. They take the shots. Parents find them dead in bed. Can you imagine as a young mother finding
it's devastating.
Your child? Can you imagine that?
I mean, I know people who know people that they were killed within days of the
And can you imagine how horrific it is when the parents say, I want an autopsy? Well, they said, I want an autopsy. And the one case occurred in Michigan, one case occurred in Connecticut. They called in pathologists, even expert pathologists. They examined the hearts. They concluded the children died of Pfizer myocarditis. What I am telling you is when I saw those cases, I was on every TV network saying, listen, if it can happen to these children, it can happen to yours.
So you address in this book vaccines that you just came out with last year a lot, not just COVID vaccine. You address, we were talking earlier about polio, of course. There's a vaccine schedule that was recently semi-simplified by the by RFK and by the FDA about what should be actually given.
Well, clarify. It was trimmed. I don't think RFK had anything to do with it. Trump on Truth Social said, I trimmed it. I gave Jim O'Neill the order. Jim O'Neill is a Palantir biotech investor who's the current interim director of CDC. And Jim O'Neill trimmed it.
You're saying RFK had nothing to do with it?
There's no indication of it.
Well, I think people credit him because he's been on a crusade to expose some of the injuries and harm, deaths done by vaccines.
You think the messaging from Trump would have come out elsewhere? Only thing I can tell you is that if I was RFK, I would have done this on day one, and I would have said, listen, it's my idea.
Done what?
Doing it. I would have, well, I can tell you, when it comes to the childhood vaccines, I think the corrective steps that are needed, and this is all based on the McCullough Foundation report, which was fundamental in changing policy. So the history of what happened in 2025 is as follows. Trump gets into office. RFK gets into office. Nothing happens on the COVID vaccines. Nothing happens on the childhood vaccines. Then we get a few months into it and they say, well, not the whole country needs COVID vaccines. Maybe just a third need vaccines. So Prasad and Macri, the FDA staffers, publish a paper in the New England Journal of Medicine that we should still give boosters, but to about a third of Americans. Well, I can tell you at that time, less than 15% were taking boosters. You can tell they were out of touch. Then the next thing that drops is September 22nd, 2025. Trump comes out in a press release, press briefing in the White House briefing room, a room that I've been in, with RFK, with Macri, Dr. Oz, and Dr. Bhattacharya. They said, we've got the answer. We know what causes autism. Everyone's like, what? What is it? It's Tylenol. Tylenol causes autism. So if the mother takes a Tylenol capsule when she's pregnant,
because you're not allowed to take Advil.
Well, let's say she takes a headache and she takes Tylenol when she's pregnant. 2 years later, when her child suddenly develops autism, it's due to that Tylenol.
You don't think that's the case?
It's absolutely gold standard science. It's not the case. So there's a large study published by Altquist in JAMA in 2024. They examined every dose of Tylenol that pregnant women took. Every trimester.
How big was the population?
2 million.
Of women?
Yeah.
They tracked that.
And they even had siblings. They had everything. Now, it turns out women who tend to take Tylenol do have slightly higher rates of kids with autism. But it's not the Tylenol. It's because they're taking opioids and all these other drugs and neuropsychiatric drugs. And it turns out there is a relationship to serious antidepressants, anti-epileptics, antipsychotics.
So extra
but it's not
drugs,
the Tylenol.
Extra drugs taken during pregnancy can lead to autism in the future.
Well, it can predispose the child to autism. It doesn't directly result in it. But the point is, McCullough Foundation, so when that press release came out, immediately we called that is a sad day for America. When Trump couldn't even pronounce acetaminophen. If you noticed how that press release came out, it looked like Trump was going to come out and tell us that it was the vaccines.
I mean, I remember people were all confused by that.
Of course they were confused.
On both sides of the vaccine issue, because the ones who oppose vaccines typically, I think that's way overblown the efficacy of them, are thinking, what happened to, MMR, some of the vaccine schedule that seems heavy for kids. And then people that
so let's sort through this.
Supported them said, I'm glad they're not on our backs anyways.
Well, the HHS every 2 years is supposed to submit a report to Congress on vaccine safety. They've never submitted a single report.
What's the policy that says that they're supposed to do that?
1986 Vaccine Injury Compensation Act. They're supposed to be doing it. They didn't do it. McCullough Foundation gets a grant to do an independent review of the vaccines, specifically with respect to autism. The title of a report...
All the childhood vaccines.
All the childhood vaccines. The title of this is the McCullough Foundation Report, Determinants of Autism Spectrum Disorder. So we surveil everything. We catalog every single paper. We independently adjudicate it. Not the opinion papers, but the original data papers. And our conclusion is there are risk factors for autism. There's not a single cause. There's a risk factor. And autism is an epidemic, particularly here in California. Let me tell you what. You have over 1% of Californian kids completely disabled from autism. 27% of the entire spectrum is profound autism. I mean, completely devastated by this.
Why do you think that's happening?
Well, here's the conclusion. Autism, as we sit here today, profound autism, is far worse than polio ever was.
I believe that.
There are more children completely disabled from autism, including the new autistic Barbie doll, who you saw come out last week. They're disabled from autism. There's a much bigger pool of American children now devastated by this than polio. But this is what we concluded from our analysis, that older parents, men over 40, women over 35 is a risk factor, premature delivery before age 37 weeks, and particularly getting early vaccines in the hospital, common genetic variants, but they're common, so they can't possibly explain this sudden surge that we're seeing since 1986. And then heavy drugs taken every day during pregnancy that affect neurosynaptic transmission. So antidepressants, antipsychotics, anti-epileptics, those are probably predisposing factors. What's the big trigger? A big battery of childhood vaccines. It's astounding. And the vignettes are compelling. The child was fine, took a big battery of vaccines, developed a fever that night or the next night, got really sick, had a seizure or nearly had a seizure. And then from that point forward, they were never the same. They couldn't look at their parents. They regressed in terms of their language development. And from that point, they was changed. And there was a very important case published about 2010 or so by Jonathan Poling, a neurologist at Johns Hopkins. This guy is top brass, and it's about his daughter, Hannah Poling. So Hannah, around 15 months or so, gets a little bit behind on her vaccines because she's for some reason, she doesn't get in for the well baby visits. So she gets a big makeup battery of vaccines. Measles, mumps, rubella, diphtheria, tetanus, pertussis, and then the list goes on and on. So she takes a big battery of vaccines. She gets really sick that night and the next night, and over the next few weeks develops clear-cut autism.
So she regresses.
Regresses.
And how old is she?
She's, I think at this point in time, 15 to 19 months. What does Dr. Poling do? He writes up her case, he studies her in great depth, and he publishes this case report. Interestingly, his case is part of the omnibus class action lawsuit. They brought forward and said, listen, my child's vaccine injured. He developed autism after the vaccines. And the federal court agrees with him and says, yeah, your child did develop autism from the vaccines. It's all in our book on a case about the U.S. Court of Claims. And so what happens with this case? Now here we have a government admission that, yes, it's real. You can actually develop autism after the vaccines. They agree with him. He publishes this. This is still in the peer-reviewed literature today. They pull his case out of being a bellwether case, and they settle separately with him.
What do you mean they pull his case? Who pulls his case?
The Federal Court of Appeals, the Federal Court of Claims, pulls his case out and says, we're going to work a private deal with you.
So the government settles out of court. Correct. With the plaintiff.
With Dr. Poling. And then the rest of the cases and all the mothers and children, they dismiss all the other cases.
So they didn't get a cent?
No.
How much did Poling get?
Nobody knows.
What's he doing now?
He's in private practice in Athens, Georgia. The point is, so the McCullough Foundation report concludes that combination vaccines are a risk factor for autism. We sent it to RFK. We sent it to Jim O'Neill at HHS. We sent it to everybody at the White House. Okay? It's in their boxes. And listen, they follow me. They're on my Substack. They're watching me on TV and all over. So what happens within 19 days of our report? The CDC in the middle of the night changes their statements on the website and says, we were wrong. The vaccines may be linked to autism.
When was this?
That was, we published our report September 27th, 2025. The CDC changes their language, I think October 15th or 19th, 2025.
Quietly. There was no press release.
No press release. They just changed that.
That's so fast. So you're saying the CDC used to say on their website, there's no link between vaccination, childhood vaccination, and autism. Now it says there may be a link.
Correct.
And this was after your report.
After our report.
19 days.
19 days. So the CDC, so HHS says, well, we're going to do our own report. And we applaud them. They've got a $9 billion budget. They've got 12,000 employees. They got plenty of manpower.
Remember, I was telling you, you got to do the homework for them, and then they'll, take your homework and say it's theirs, and you're good.
Now what happens within 90 days of our report? Trump goes out on Truth Social and says, you know what? Our vaccine schedule disgrace, I trimmed it. That's what he says. Jim O'Neill, there's a picture of Jim O'Neill signing the thing that Jim O'Neill, so neither Trump or O'Neill are medical people. They trimmed it. So what did they remove? They went from 17 vaccine preventable diseases to 11. They made our schedule look similar to that of Denmark, which is very reasonable. Denmark, by the way, has better control over infectious diseases than we do. And I think they removed probably the least contentious vaccines, like the oral rotavirus vaccine and others. They kept the two big ones.
They removed HPV for little kids, right?
Well, a lot of this has been moved to what's called shared decision-making. And they left the two.
I love these terms.
Well, I mean, they left the two big ones,
Mm-hmm.
which are measles, mumps, rubella, and diphtheria, tetanus, pertussis. Those triple combinations, those are still in a schedule. And people say, well, why does the schedule even matter? It matters because in many states like California, the schedule is written into law, and you can't send your kid to school unless you can achieve. So you'd ask, well, what would I do? If I was in RFK's shoes, on day one, I would have suspended the vaccine schedule, and I would have said, listen, there are no vaccine requirements or mandates. A vaccine is like any other drug. It's between the doctor and the patient. It's free choice. No one should receive any pressure, coercion, or threat of reprisal. Second thing I would have done, I would have rescinded the 1986 Vaccine Injury Compensation Act. I tell the president, listen, do this. as an executive order, because you'll need a congressional act to do this, and have the companies face liability like they do for every other medicine, you'd watch a ton of vaccines come off the market because the companies don't want to face any
liability.
Would have removed all vaccine requirements for the military, for employment, what have you. All the tension would come out of this if we actually just did this. But here we are today, 1986, liability protections in place. We still have vaccine requirements. We're just seeing a choreography here and then lots of distraction. So instead of saying, I would have pulled the COVID vaccines off the market day one. Listen, there's manuscripts published to this effect. There are petitions. I've testified in the U.S. Senate multiple times making the final conclusion.
So what you're saying is we should have removed the requirements for childhood vaccination schedule. It can still be suggested if they want, but it has to be up to the parents and the doctors, et cetera, et cetera. There are some states where that is the case, where there is medical freedom and it is not a requirement. It's a recommendation to have the childhood vaccination schedule in order to go to public school, as an example. Then the critics of that public policy approach of vaccinations should be totally voluntary, they should not be required, say that, well, those states, the kids are less healthy. There's more outbreaks. Case in point, Texas, they say, well, there's all these outbreaks of, is it measles? Measles, right? Mm-hmm. That's what the big one where if they don't take MMR, there's all these outbreaks. So clearly the vaccine is working because in states where they take the vaccine, they don't have as many outbreaks.
But remember, if a child does not take a measles vaccine, they can't have a measles vaccine death.
Why do you say that? If a child doesn't take the measles vaccine, they can't have a
measles vaccine death.
Right. Of course, yes. But they can have a measles death is the point of the person
so
who's
then you
criticizing
have to ask,
policy.
which is worse?
Yeah, what is worse?
Measles vaccine deaths.
So you think the deaths from the vaccine are worse than the deaths from measles?
Yes.
But then the critics would say, well, that's because less people have risk of getting measles because they're already vaccinated. So it's not apples to apples, it's apples to oranges.
Well,
if every kid got measles, the deaths from every kid getting measles will be worse than the deaths of every kid getting the measles vaccine.
Even in the height of no measles vaccine in the United States, with no ICU care, no modern measles treatment care, nothing.
What year are we roughly?
Let's say 1962. Okay. The whole country got measles. How many measles deaths were there?
How many?
About 350.
A year.
Yeah.
And
no treatment. Now, nowadays, let's say a child gets measles. First of all, they get separated from their other children. They get adequate hydration. They get a vitamin A protocol. The contacts of the kids around them get measles immunoglobulin. They develop any signs of pneumonitis and encephalitis, they get corticosteroids. Secondary pneumonias, they get antibiotics. Do you know in that year, there was a paper published from the United Kingdom. They had meticulous measles records. Do you know the rate of measles deaths was 0.2 per 10,000.
0.2
yes.
children per 10. But so how does that compare to the 50s when 350 kids died?
It's about the same.
Because it's about the same. So
the point is, without any treatment, the kids who died of measles were malnourished, kids with congenital heart and lung disease. It's not healthy kids die of measles. Remember when the Brady Bunch got measles? They just kind of laughed it off. It's a few days off work. It's no different than a rash in children called pityriasis rosea, which we don't have a vaccine for. Children get viral rashes. But the point is, measles vaccine deaths, any death should be considered completely unacceptable. We should never have a child exposed to something that can kill them for theoretical benefit. So has that ever happened? Well, in the VAERS system, there's about 800 measles vaccine deaths since 1990. There's a very important case published at Stanford here in California. And a little baby comes in, they give him the measles vaccine. Little did they know that the child a few weeks later was coming down with acute myelogenous leukemia. Well, that measles vaccine, the measles, which is a live virus in that baby, mutates, invades the baby's brain, rots out the brain and kills the baby in front of the parents. That's unacceptable.
But then did they say the death was the consequence of the leukemia?
No,
So
the conclusion
they
of
properly
Stanford was,
classified it.
right. So the point is, no parent should hand their baby over for something that's supposed to be good for them and have a death.
I agree.
One death should be unacceptable, and that because of the risk of death, we should allow people to have a free choice. And you know what? For any disease, get treatment. Even if we had polio today, we have supportive care, we have plasma exchange, we have corticosteroids, we'd have other things that we do for Guillain-Barré syndrome and all the other syndromes. Every illness is treatable. We can't look at deaths in the 1960s and say those deaths would happen today. We can't say, well, we're going to accept some deaths now for others. I've even had mothers online say, you know what? I'd rather have an autistic kid completely neurologically devastated than have my child die of measles. They think that's the proposition.
I know. And the problem is, like you're saying, there's no good data to prove that the vaccine, for measles is somehow going to make them safer than if they were to not get the vaccine. I mean, that's the problem. That is the problem.
Did you personally get the measles vaccine?
Did I personally get it as a kid? I'm not sure. Probably.
Listen,
I don't even know.
I
should maybe know that.
When I was born, there was no measles vaccine. But by age 2, there was a measles vaccine. I'm
sure I got it.
My mom raced me in, and I got a measles vaccine. Well, okay, then what happened? Well, I never got measles. My parents did, but I never got measles. And so I enroll in medical school. They said, well, we better check your immunity for measles. I get a blood test, no immunity. Get another measles vaccine. Well, I got another measles vaccine. Okay, then a few years later, I'm starting my fellowship. Well, you have to be checked for measles. I get another blood test. No immunity for measles.
Don't they have to give it to you, that one, every decade or two to refresh it?
Measles, you're supposed to have it lifelong. Supposed to be good for life. So the point is, I go through 4 of these. You
had 4 measles vaccines?
Well, the third and fourth one were the MMR. Now, I had already had mumps. I didn't need another mumps vaccine, but you can't get a single. The point is, I've had it 4 times. I've never had any evidence of immunity to it. My colleague out in West Texas, caring for measles patients, he was like me. He went to Baylor with me, Dr. Ben, and guess what? He's taking care of measles patients. What happens? He gets measles. So the measles vaccine,
even though he's been vaccinated,
correct. So the point is, the CDC is deceiving us when they do a measles outbreak investigation, and they say 95% of people are unvaccinated or vaccine status unknown. Well, wait a minute. The CDC's got 12,000 employees. They have CDC officers. They should know the vaccine status of every case.
What you're saying, what it sounds like you're saying is the government blames the measles outbreaks on people who are vaccine hesitant or who do not get the vaccine. And what you're saying is measles outbreaks will happen regardless of the vaccine.
Right. So someone like you just told me, you don't know if you took the vaccine, you would be considered unvaccinated or vaccine status unknown. If I couldn't find my vaccine record, I would be considered vaccine status.
Oh yeah, I doubt my mother has my vaccine
So the CDC is lying to us.
I see.
Because they're not telling us the truth. A paper by Bianchi and colleagues. Notice in this interview, I am citing paper after paper after paper. No one does this at the CDC. No one does this. Dr. Peter Hotez in Houston doesn't do this. Paul Offit at Pennsylvania doesn't do this. Bianchi and colleagues found people enrolling to medical school. If you had measles as a child, 96% of the time you had bona fide immunity to measles.
That's the best way. That's the best way to
If you took the vaccine, you're only about 80% chance.
So, this is part of the medical industrial complex is, they own the search engines, whatever. You type in Google measles risks, right? This is what scares your average parent who's thinking, well, maybe do we need to get the measles vaccine? It's MMR. There might be these risks. And I want to ask you about the risks in a minute too. So there's the question of, does it do any good, the vaccines? Like how much good does it do against diseases that might be curable and are not as big of a deal? And then there's a question of, do they cause damage, the vaccines, right? So there's actually 2 sets of questions that are just as important because they can both have to do with the health of your kid. So you'd say measles risks. Measles risks include severe complications like pneumonia, brain swelling. That one really scares parents because they think, is this child going to be mentally disabled from measles?
Right.
ear infections, blindness, also very scary for parents, even death. So you read this and it says, unvaccinated individuals are the most vulnerable, facing hospitalization risk and long-term issues like subacute sclerosing panoencephalitis, SSPE.
All of those, all the neurologic complications are readily treated with proper use of steroids. Essentially, it's not an issue. Same thing with
so you can prevent brain swelling when you
Correct.
get measles if you take steroids.
Correct.
You're going to be okay. Is what you're saying.
That's well described in the peer-reviewed literature. Do you know how many cases of measles there are in the world per year?
How many?
Well, how many are in the United States per year?
I mean, now it's down to 50, right, or less?
No, a couple thousand. Yeah.
Oh, really? It's a couple thousand. Oh, I'm talking about deaths. What are the deaths from measles in the U.S.
Well,
right now?
United States, we haven't had any.
We haven't had any.
There were 2 deaths in West Texas, and one family, this little girl, she got no treatment. She got no corticosteroids. She got no secondary antibiotics, nothing. So she died of a lack of treatment. That was actually investigated. Dr. Pierre Corey and my colleagues went out there, investigated. Ben Edwards, my colleague out there, verified it. Then a man died, but he had a heart attack, and he was probably getting over measles at the time. So that wasn't counted as measles death. But on average, we have 1,000 to 2,000 measles deaths a year in the United States. How many worldwide? Because a lot of countries don't vaccinate for it. 600,000 worldwide.
Cases, not deaths.
Cases.
And how many deaths?
The deaths in the WHO reporting was 36, but none of them out of 600,000.
36 total global deaths due to measles?
And none of them were adjudicated directly due to measles. So my point is, listen, if the measles vaccine went away today, sure, there would be cases. The reality in my book, let me show the book for the camera. So measles, so vaccines, mythology, ideology, and reality. The reality is measles vaccine drops the case count of measles. That's the reality. It's wonderful. Okay. But it's also the reality that if we didn't have the measles vaccine, with modern treatment for cases that were severe, we would get through it.
But you said earlier, if I remember correctly, I think it was in the 50s when there was no measles vaccine and there were a number of outbreaks, there were 350 annual deaths.
Correct.
That doesn't sound insignificant. That's significant, 350 deaths. That's certainly more than 0 deaths, or now there's maybe 2.
I know, but it's 350 with no treatment. I would contend that 350 today should be 0.
With treatment, separate from the vaccine.
Yeah, with modern medical care, should be 0.
What are the risks, if any, in your view, of the measles vaccine, which virtually all children are told to get today?
There's about 800 deaths in the books. We're investigating
since 1990.
Right.
So what is that per year? What is that? What are we doing? What are we at? Let's pretend we're at 2030. Be generous.
Yeah, 30 or 40 deaths a year.
30 or 40 deaths per year. And you're saying that even if every child got measles in America, you think we could get the deaths down to 0?
They'd be close.
They'd be close.
Probably fewer with measles, more with the vaccine. But the point is, the measles vaccine is not saving humanity. Now, hospitalizations are contrived. This is very important. In the paper by Miller.
And by the way, sorry to interrupt you, but it's sort of not apples to apples to say the deaths from the measles vaccine, 30 per year versus deaths from everybody getting measles, because the reality is not every child will get measles, or is that unfair to say? If we really let measles run rampant, would every kid get measels?
No.
It's very infectious, right?
Yeah, it's very infectious, but not everybody would get it.
So what are we thinking? 40% of kids would get it?
Yeah,
60%?
some reasonable fraction of kids would get it. It's very similar to pityriasis rosea. We don't have any vaccine for that. The point is that hospitalizations are contrived. You know, back in the olden days when Miller and colleagues reported in the 1960s, we didn't put kids in the hospital unless they were sick. Do you know it is conventional medical practice today to put kids in the hospital with measles, even if they're not sick?
Even a mild case. Because they would say, well, we're monitoring it to make sure there's no brain swelling.
No, it's not even that. It's just saying we're providing isolation. So they're providing isolation in the hospital. So they count that as a hospital statistic. So they say, oh, measles today has a 20% hospitalization rate. It's completely elective. So one of the mothers of the Mennonite people out in West Texas who don't take vaccines, they've never taken vaccines. One day she calls me. And I said, well, gosh, what's going on? She goes, listen, we don't take vaccines. We've never taken vaccines. Our kids get measles. They tell us our kids should go to the hospital. You know, we're not going to bring them to the hospital unless they're sick. And the 2 deaths that have occurred over 2025 were not adjudicated due to measles. They get through measles every year. So do the Amish. Forever and ever and ever, 2.5% of American kids don't take vaccines. Forever and ever and ever, they've gotten through measles. It's not the end of the world. The reality is the vaccine drops the case count. Fine. Same thing with chickenpox, by the way. Did you have chickenpox as a kid?
I did. Yeah, I remember that. I remember the little red dots.
I had it. Dr. Drew, who's in my circles, Dr. Drew Pinsky out here in LA, Dr. Drew, he said he didn't get his kids vaccinated for chickenpox intentionally. I said, gosh, I'm kind of shocked. My kids got vaccinated. What does the chickenpox vaccine do? It drops case counts of chickenpox. Wonderful. What's the downside? Higher adult risk of shingles.
Yeah, shingles is the worst.
So remember,
my grandpa got it.
There's always
Horrible.
a consequence. There's risks and theoretical benefits. Remember, vaccines are real risk. If your child dies after the measles vaccine, or has Guillain-Barré syndrome after a flu shot, or is paralyzed, that's real. Your child does autism, that's real. So the risks are real. The benefits are only theoretical.
I think that's the most compelling reason why an increasing number of parents are vaccine hesitant or questioning. Because when you get that needle inserted in your child's body, you know there are actually unknown risks that you are accepting now for your child intentionally. And the unknown part is the scariest, because who to trust? There's studies that you're referencing, and then you type on, Google, and it says, there are no, risks to this vaccine whatsoever, or there might be mild discomfort. You just see so much, you're not sure who to trust. But then theoretically, like you're saying, there could be a risk in the future. Maybe your child could get measles. Maybe that could be a severe case. Maybe the child will be hospitalized. But you're weighing an actual risk that you're intentionally receiving against a theoretical one.
Yeah, the benefits are theoretical. So here's an example. So your kids are growing up, and they're good little kids. They're following what mom and dad tells them to do. And you're contemplating getting the HPV vaccine, Gardasil vaccine. Listen, if your child doesn't get a tattoo or have torpid sexual affairs and encounters with all kinds of other kids, or does IV drugs, if they don't have the risk, there's zero theoretical benefit of taking the vaccine. So what I'm saying is a vaccine's like a drug. I'm a doctor. I can decide who needs a vaccine and who doesn't. For every vaccine, I can decide where the compelling case is for a child to take a vaccine. And I would say for a respiratory illness, when they can die of that respiratory illness because of baseline malnutrition, cystic fibrosis, congenital lung disease, they should get those vaccines. If a child does not have a spleen and they can die of an encapsulated infection like Haemophilus influenza B or pneumococcus or meningococcus, they should get that vaccine. If it's a gay or bisexual young male having anal intercourse, they should get the hepatitis B vaccine.
I would say don't have anal intercourse.
No, but they should get, what I'm saying is, as a doctor,
I hear what you're saying, yes.
I can decide who needs a vaccine or not, and I can decide with the parents. A schedule is not helpful. Having a school requirement is coercive. Making this a precondition for employment or the military. You can see how we're coming to a point where it's not going to be our government officials that are going to save us here. It's about people doing their own research, listening to your show, listening to all points of view, and understanding there is a pro-vaccine bias built into everything that comes out of the WHO, the CDC, artificial intelligence, Google, and what have you.
It's actually stunning because
but it's baked in. It's 300 years of this. Remember, as a parent in 1890 in Boston, if you didn't have your child smallpox vaccinated, you, the parent, would go to jail.
In 1890.
Yes.
So this is not a
And that would happen
thing.
in Toronto. That would happen in London. Well, there was a city in the UK that said this is madness.
And your book traces the history of that.
Correct. Listen, this has not happened before. This has happened before. There is an ideology. There is a religious belief in vaccines. That's the reason why people are not thinking clearly. This religious belief is programmed into these public health agencies. Just go on the WHO website. They say one of the top 10 advancements in public health is vaccination. And some schools of public health, and listen, I'm a graduate of the School of Public Health. Most schools of public health claim that vaccination is the number one most beneficial public health intervention ever devised. Better than water sanitation, better than nutrition or hygiene.
I mean, that's everywhere. And you're saying it's complete bunk.
I'm saying that it has to be considered in the risks and benefits.
Mm-hmm.
I took 69 vaccines. I took 69 different doses, probably far more than you, than anybody in this room. I can tell you, I cannot be labeled as an anti-vaxxer.
But if you knew what you knew today and you had the choice, would you still take those 69 vaccines?
No.
None.
If I knew what I know now, and I'd rely on the McCullough Foundation report, which now summarizes 12 studies, 12, showing a healthy child born today, and I was healthy, my kids were healthy. A healthy child born today remains healthier if they take no vaccines whatsoever.
And the data shows that children who don't take vaccines are healthier if they're starting out as healthy.
They're healthier. Why? They're healthier because they have much lower rates of allergic diseases that are probably triggered by vaccines, lower rates of food allergies. We're talking asthma, allergic dermatitis, all kinds of GI intolerances, peanut allergies, you name it. They have lower rates of neuropsychiatric disorders, including attention deficit hyperactivity disorder, autism spectrum disorder, tics, involuntary facial movements, and seizures or epilepsy. By far, the data are clear on this. And so people are walking away from vaccines right and left. There's a paper by Vesuvian and colleagues published in JAMA recently. 60% of young mothers and fathers are not following the full vaccine schedule. 60%. They're not going to. What's going to happen?
This is the post-COVID impact, I think. People
Right.
I think, lost, once they started to do their own research, because everyone was kind of scrambling and doing it during COVID, they started to realize, oh, a lot doesn't add up that I just assumed added up before when it came to recommendations from the medical establishment.
That was me. Listen, I took all the vaccines. I took 40 flu shots, so 40 out of my 69 shots. Why? I figured, well, there's no harm in doing it. I never worried about flu. I never even tested for it. But I was told I should do it. It's a good thing to do. And then later on, I was told, well, you have to do it to stay on medical staff. Then later on, I was told, listen, if you don't take a flu shot, we are throwing you off medical staff. I mean, it became more severe over time. So, okay, I took a flu shot. Well, was there any consequence? Well, I never got flu one way or the other, but I got to the point where I was sick virtually every month with viral upper respiratory tract infections. Sick. What do the studies show? Well, there's a randomized trial done in adolescents showing that influenza vaccine reduces a little bit your risk of flu. It's minimally effective, but it markedly increases your risk of the common cold, which was happening to me.
Wow.
Now a paper by Shretha and colleagues, Cleveland Clinic, of the 51,000 Cleveland Clinic employees, those who got the flu shot, much higher rates of influenza and cold and other viral illnesses. So with every vaccine, there's risks and there's benefits. Healthy people, I stopped taking vaccines in 2021. I've never felt healthier. Now it's been 5 years. And I feel healthier. I think a lot of people are going to have that same conclusion. Different scenario for different risks. If someone's going to go be a missionary in an at-risk place for yellow fever, get a yellow fever vaccine or a typhoid vaccine. Again, we talked about IV drug abusers. There's 25,000 women who have hepatitis B who are pregnant, going to have babies. Most of them come from overseas. They're immigrants to the United States. They need hepatitis B vaccination. So do their children. The mothers, by the way, also get an antiviral called fasinavir, and the babies get hepatitis B immunoglobulin. So for 25,000 children, they need interventions to reduce the vertical transmission of hepatitis B. But of the 3.6 million healthy babies and healthy mothers, they don't need the hepatitis B shot at all. The point is, an intelligent doctor, intelligent mother and father, we can figure this out. We don't need the government and we don't need a schedule.
I remember asking with my firstborn, a pediatrician in Los Angeles about hepatitis B, because I thought, come on, this is a little overblown for my 3-month-old baby to get this. Are you sure? Can I delay? We don't have any exposure. I don't have, there's why? And she said, well, he could step on a needle at the park and get hepatitis B from a drug addict. That was because I was trying, it's like, how would he get this disease? Like, how is this going to protect him? And she said he could step on a needle in the park. And I thought, wow, we've entered that time where now you get the hepatitis B vaccine when there's no way you could possibly get the disease because you might step on a needle in a park. How about we clean up our parks? Or as a mother, I'm not going to take him to a park where drug addicts hang out.
Well, I mean, think about this. The polio vaccine is only 60 to 70% effective. Now, it's a pretty clean vaccine. You know, I took it, my kids took it, but we haven't had polio in the water supply for 20 years. So there's no way I got exposed to polio. You haven't gotten exposed to polio. My kids haven't gotten exposed. The vaccine was unnecessary. The benefits are theoretical. The risks, even if they're rare, they're real. Vaccines have come into center focus right now. And I can tell you, I've met a lot of young mothers, and the young mothers who have not vaccinated their children are healthy as horses. These mothers are not going to turn around and start having their kids take vaccines. I know a lot of people, now 19% of people in the United States did not take a COVID vaccine. I didn't take one. There is no way that I'm going to take a booster shot now.
I have friends who, this is totally anecdotal, of course. I'm curious what your take on this. People that got the COVID vaccine who just are getting sick a lot more. Colds, flus, they always have an issue. Is that something that the data bears out?
Dr. Melissa McCann in Australia proposed what's called a term of reference in the COVID vaccine inquiry of the country of Australia. The term is called VAIDS, Vaccine-Associated Immunodeficiency Syndrome. The SARS-CoV-2 vaccine, the spike protein on the vaccine, suppresses the human immune system. People get sick more often.
Lifelong?
We don't know. The data from Cleveland Clinic is horrible. The more shots people take, the sicker they get with recurrent infection. And that's what I see in my clinical practice. People don't get healthy until they stop taking boosters.
That's such a scary.
Well, what can people do? If people have stopped taking shots, they can take detoxification. So we built a company around this. Talk about powerful. This is called Ultimate Spike Detox. It's a combination of nattokinase, bromelain, and curcumin. Nattokinase and bromelain in scientific studies, peer-reviewed and published, dissolves the spike protein.
So you're recommending this for people who took the COVID vaccine as a way to combat the spike protein?
Correct. Very important. And
do you have any studies on its efficacy?
We have peer-reviewed, very positive case vignettes. We have the preclinical data, which is very solid, and we have mounting antibody data showing that people who take this, their antibodies to the spike protein go down as the spike protein is removed from the body. This is perfect for RFK and Dr. Jay Bhattacharya to do a large prospective, double-blind, randomized, placebo-controlled trial, which will cost about $100 million. But yes, we want to see the government do $100 million studies on how to help people after they've taken the shot. Do you know how many they've done? 0.
What is next for you, Dr. McCullough? What are you, I mean, I know you've got your company now, you're writing books, you speak on this regularly. What do you want to see happen and what's next for you?
I do 3 things. I'm in clinical practice. I'm age 63.
Did they take away the board certifications or no?
I resigned from the American Board of Internal Medicine, but I'm fully board certified by the National American Board of Physicians and Surgeons. So I mean, it's not.
Again, that's Wikipedia saying he's not even board certified, which is a lie. You do have board certification.
I see patients every day. My board certification is perfectly fine. So no, don't believe Wikipedia. Wikipedia, when you look at their source, what did they source? They actually source.
Let's pull it up really quick here.
Factcheck.org. Or they'll source the American Board of Internal Medicine website, of which I resigned from them. And then 3 months later on their website, it says revoked.
So yeah, it says the American Board of Internal Medicine. So you are board certified by which board?
The National Board of American Physicians and Surgeons, NABP.
So it's saying ABIM recommended that the certification's been revoked because of your misinformation about vaccines.
But I resigned with a legal letter with my attorney reserving my rights.
So it's claiming, according to Wikipedia, that they revoked the certifications, ABIM, in 2025, January 2025.
If you were to ask me,
MedPage, your favorite.
MedPage, right? So again, those are not authoritative sources. But if you were asking me, Dr. McCullough, do you have a letter of decertification from the American board? No. And you know why? Because they can't do it. I resigned from the American Board of Internal Medicine.
That's interesting because it sources this saying, in the search of ABIN certification lookup tool, you search it and it says not certified, revoke. It's not clear exactly when the credentials were revoked because they never were, to your point.
Yeah.
Very, very interesting.
So the point is, listen, I'm fine.
The point is.
I'm in clinical practice. I'll do that probably for several more years. I am the chief scientific officer of the wellness company, which is the fastest growing, most beneficial company for American health by far. Wellness company blows away Robert F. Kennedy, Health and Human Services, CDC. The wellness company is offering healthcare to the entire country and is positioned for pandemic response. We make emergency medical kits, all kinds of things to help people through the crisis, help people with the Ultimate Spike Detox and other products to help them get past the vaccine. So the wellness company is probably the biggest corporate development coming out of the pandemic, and I've played a major role. I'm one of the officers in the company. And then I'm president of the McCullough Foundation. McCullough Foundation has already dramatically changed vaccine policy in the United States.
And you think the CDC coming out and saying now measles, or excuse me, the autism may be linked to the MMR vaccine. Actually, it didn't say the specific which vaccine, did it? Did it say the CDC?
It said it used the identical wording we used in our report.
Which is?
That is the combination of vaccines.
Okay.
So the point is...
But you're saying you credit your research with these slight position shifts coming from the administration.
There was nothing else that could be pointed to as an impetus.
Do you
Nothing.
think they're going to move more based on what you've seen? More meaning the administration, the Trump administration, RFK is going to finally say, no, these vaccines should not be mandatory. No,
the administration, I think, is going to be and remain relatively unhelpful. I think it's going to come from the people. The statewide organizations are going to make a big impact. In Texas, we have Texans for a Vaccine Choice. They have helped dramatically. In Texas, you go onto the website, you download a form. As a parent, you fill out the form. You can have philosophical, medical, religious exemptions. Fill out the exemption form, go get it notarized, put it on file at the schools. You're done. You never have to visit the issue of vaccines again. Texas, the COVID vaccine mandates are banned. If anybody tries to tell you to take a COVID vaccine in Texas, they're violating Texas law. I think it's going to be up to the people and at the state level. I don't look for anything from, listen, we've been through Trump 1.0. Then we had Biden. Now we got Trump 2.0. And what we see is distraction. Instead of being laser focused on the COVID vaccines, the danger, 500,000 Americans have died. We see, all kinds of sojourns and explorations into fluoride and food dye and completely deceptive conferences on Tylenol, a dose of Tylenol. You think
the food dye thing is without merit?
And then I'm just listing the distractions.
Sure, you consider that a distraction, the food dye stuff, because red dye 40 is not a good thing.
Well, what I'm saying is it's a distraction, just like eating tons of red meat and saturated fat. And we've seen Trump sign a bill for kids drinking whole milk. These are distractions from
the biggest issue in your view.
Now, do each one of these small issues, could they be of importance? I never fed my kids Skittles.
Why? I know we're going to wrap here in a minute, but why do you think there is such a hesitancy to really deal with the elephant in the room?
Because it's a religious belief.
It's a deep ideological
no
tradition.
One wants to. Are there deep religious beliefs about food dyes? No.
Yes,
so I think, is there deep religious belief about...
Well, and is there a big lobby behind food dyes? Like who's profiting off of food dyes the way people are profiting off of vaccines?
There is some. To be fair, the food industry, so there's kind of, the red and yellow dyes are pretty much the only ones we worry about. But yeah, that's big food is behind that. There's fluoride and fluoride products, and we can go on and on. But there is, to RFK's defense, as they're worried about these smaller issues, there are lobbyists behind all of these, and there's a whole history of American policy being wrong, from insecticide to polluting waters to mercury and lead. there's a whole history. Now, if we could just go back in time, if you and I could go back to 1870, besides worrying about the smallpox vaccine, if you were to have a medical problem, chances are your doctor would prescribe for you an elixir of cocaine. And you would rapidly get hooked on cocaine. Chances are your doctor was hooked on cocaine. That's how deep medicine was wrong on an issue. It went from 1860 to 1920. There was one paper of concern published in JAMA during that period of time. One
on the issues of cocaine
addiction.
Right. So I think about the cigarettes. Literally, they would say it's healthy to smoke cigarettes.
Let's go forward in time. So it's 1945. You and I go to see our doctor. The doctor says, here's some cigarettes. They're in the waiting room. The doctor smokes. All the doctors, all the nurses smoked. Everyone, American Tobacco Company, RJR Reynolds, Philip Morris, they all had doctor cigarette campaigns. Smoking, 1920 to 1978, no correction by the doctors. Even there was the Medical Research Council in the UK, 1950, 1954. It didn't sway them. Surgeon General report, 1964.
People are dying of lung cancer,
right.
And it didn't matter.
And the doctors are like, no,
it's not happening.
It can't be the smoking. Just like they denied cocaine, they denied smoking, and now they're denying excessive vaccination and messenger RNA vaccines. It's the same. But the point is, don't look for the federal government to save you. Don't look for the medical orthodoxy to save you. Do your own research. Do your own reading. That's the reason why these books are so important. They can't be censored. They can't be Google searched. AI can't rewrite them. They're in print. You can read them. It's very important for people to do their own research now. I'm glad I did because I'm not wrong on this. Joe Rogan, the last comment here, Dr. Peter McCullough was right all along. Joe Rogan. This is about coming out on the right side of history. Trump is wrong. Biden is wrong. Trump 2.0 is wrong.
Last question, Dr. Peter McCullough. I know that you have, your books, your company, but what advice do you give to parents, especially parents who are in states that are not medical freedom supporting? I mean, you think about a state like New York, Connecticut, California, some of these blue states that they mandate full schedule of vaccinations for kids, not fully mandated. I need to walk that back. For certain school privileges, you need to be able to fully vaccinate, et cetera.
Right. Well, what I would say is this, is that a parental choice of what happens to their child is the ultimate responsibility. The school is not more responsible. The federal or state administration is not. The parent is most responsible. So parents are making their decisions. There's something like 20 or 30% of Americans just move between states per year for jobs. There's now probably more than half of adults that are working from home online. They're doing all kinds of things. So parents have to navigate. Parents are not cemented into the ground anywhere. No one is. So a lot of people are moving. Some people move to states like Texas. They say, listen, forget California. It's too expensive anyway. They make their choices. If you were going to say, listen, I'm wedded to staying in a state that's mandating all these vaccines, that it's far safer to try to split up the vaccines as much as possible. It's far safer to take them individually, and it's far safer to delay later in life, certainly beyond age 4 years. 4 seems to be the magic time frame. So what some parents do is say, listen, I'm stuck living in New York. I'm stuck living in California. I'm just going to wait till after 4, and then I'll step them through to get to some minimum level to go to school. But no one's doing this, happily, and they should have their voices heard. But, this idea of, well, I was forced into it.
They're not holding you down. And
listen, I'd lose 3 jobs. I'd lose 30 jobs to not take a COVID vaccine.
Wow.
I'm sorry. There's just, it's too easy to, we're very labor constrained in the United States. If people haven't figured this out, we don't have enough people to actually work in this country.
It's true. There's so many
work all over.
Opportunities if people are willing to get creative and also not have a limited mindset of I have to stay in California, I have to stay in Connecticut or wherever they are.
Right.
There's opportunities.
Are truly stuck. They're caring for an elderly person or other things, but they have to navigate and they have to understand there's a risk. And the toughest cases I have are people who knew the COVID vaccines were unsafe. They felt forced to take them, and they suffered heart damage, cardiac arrest, have a pacemaker in, have blood clots. They're absolutely miserable. They're absolutely miserable. And every single one of them, I asked them, if you could do it over again, would you skip the vaccines and do something else? They say, you bet I would.
They'd quit the job.
I'd quit the job. I'd drop out of the military. I'd go be a contractor.
Wow.
I'd go do something. No, I wouldn't do this again.
All right. Thank you. Thank you for your courage, Dr. Peter McCullough. I mean, I think it's really, I want to commend you for it, because I know that it doesn't always come without its sacrifices.
I wouldn't change a thing. What's gone on now, as we realize over the last 300 years, and for sure over the last 5 years, is a mind-blowing reality. We didn't touch on some other horrible developments like the transgender movement, etc. But let me tell you what, now is a time for courage. Now is a time to pursue truth. Now is a time to step up. We're not going to be saved by any world leader. We're not going to be saved by any drug company. We're going to have to save ourselves. Now's a time for discernment. Now's a time to seek the truth and to realize that our common sense, our intuition, our maternal and paternal intuitions are far stronger than what people tell us. It's very important for people to understand. I wouldn't change a single thing. This pandemic has been the capstone to my career. I have published and promoted, promulgated, and fundamentally spared tens of millions of deaths, hundreds of millions of hospitalizations through my innovation. And now, thankfully, through the Wellness Company and a wonderful group of people, we are now having people emerge from the misery of long COVID, vaccine, injuries, disabilities, and deaths by the tens, if not hundreds of millions, maybe billions of people. And I've been on some shows where the reach has been greater than 1 billion people.
I pray that your work can help change the course here, so that at least at minimum, there's more awareness, like you said, discernment, and I hope medical freedom. Thank you so much for joining the podcast.
Thank you.
Thanks so much for listening to this episode with Dr. Peter McCullough. If you like what you see at The Lila Rose Show, please consider supporting us over at patreon.com/Lila Rose Show. This is how you can keep this show going. Also, for those that subscribe as an annual paid patron, you get your choice of one piece of our free merch, which I absolutely love. And if you're a monthly patron, you get 30% off all of the merch. Thank you so much. A big thank you to our channel partner, EWTN. EWTN is the world's largest religious broadcast network, reaching millions of people every single day with the beautiful truth of the gospel. You can be the first to watch new Lila Rose Show episodes 24 hours before YouTube over at EWTN.com/on-demand and on the EWTN app.